Hello, I'm Dr. Hanume Gowda, consultant orthopedic surgeon practicing at AHA Orthocare, Nagarbhavi, Bengaluru, specialized in joint replacements and spine surgeries. Arthritis is a very broad terminology. Arthritis means inflammation of the joint. What is inflammation? Pain and swelling in the joint. We label it arthritis when it goes beyond a certain period of time. Sometimes it's 4 weeks, sometimes it is 6 weeks. There are two main causes for arthritis. One is infection, the other one is inflammation. Infection is there is a pus or some sort of organism which has gone into the joint and led to pus formation in the joint. So that is infective arthritis. That is a totally different category. It doesn't come under general arthritis category. So now we come to the main arthritis category, that is general arthritis category. Usually arthritis are multiple varieties. Commonest is the rheumatoid arthritis. Rest all are related to this or something similar to this. So arthritis diagnosis is very simple. If you are suffering from joint pain for more than 6 weeks, you probably have an arthritis. This should happen without any reason. In the sense, there should not be any injury, there should not be any fever, just a joint pain and swelling restricting the joint movements. Restricting the joint movements is you are not able to do complete movements of the joint. When this happens for more than 6 weeks with swelling, with pain, then probably we can label it as arthritis. Then what sort of arthritis is it? Can be found out only after examination clinically. We check the patient, sometimes the joints involved are only one in the body, sometimes only one particular limb of the body is involved, sometimes multiple limbs are involved, sometimes symmetric arthritis. That is, if you get arthritis in the right hand, the left hand also will have arthritis. If you have it in the elbow, left elbow and right elbow, both will be affected. Similarly, both knees getting affected. Then there is a last variety of the arthritis that's called age-related arthritis called the osteoarthritis. This happens because of age-related wear and tear. What is age-related wear and tear? There are two bones. This is the bone, and that is the joint, that movement. So between the two bones, there is a layer called cartilage, which is a little bit of rubbery type of consistency, which gives that smoothness of the joint. As age advances, joints which are more commonly used or more heavily used, like the knee joints or the ankle joints or the hip joints, generally these cartilages starts wearing out. It happens to each and every person. Some people it wears out faster, some people it wears out a little bit slower. But everyone will have some sort of wear and tear in the joint that leads to swelling and also deformity in the joint. Now this is called an osteoarthritis. So there are three important categories: infection, inflammation and arthritis. To find out which sort of inflammatory arthritis you have, you will need a lot of blood tests done. The basics are like getting the inflammatory markers. There is something called inflammatory markers and also specific joint inflammatory markers. This can be done in most of the laboratories these days to find out which type of arthritis you have. Based on the type of arthritis, your progress will depend. Sometimes the arthritis, rather not sometimes, most of the times, they are called self-limiting disorders. That is, after some time, they stop becoming inflamed and they just settle down. There are these autoimmune disorders which happen in the body where the immune system of your body reacts with your own immune system, and that leads to a reactive process that gets settled in the joint and leads to arthritis. These are called autoimmune arthritis. These are self-limiting sometimes, and sometimes they can go on for long. How long will it go on and how far it will drag on, we won't be able to predict. Prediction is not possible as to how long this is going to affect you. The only thing that we can do is treat them and keep it under control till the reaction in the body goes on. As and when the body reaction comes down, the arthritis will sort of come down and you will be better. Till the time that reaction in the body stops, the treatment has to be taken, or else the joints may get deformed because the inflammatory process will damage the cartilage. Between two bones, there is a rubbery-like consistency which is present, which is called cartilage, which will give you a smooth movement. That gets damaged and the surroundings of the joint also gets damaged, and the pain and swelling may become permanent. Sometimes the joints get deformed. So treatment is required till the reaction in the body is going on. So what type of arthritis and what will be the treatment protocol? The arthritis, as I said, if it's age related, the treatment protocol is very simple. You take analgesics, you take physical therapy. If it's not improving, you may need some sort of injections in the joint. Even if that doesn't work, then operations are the way to go. These can give you good long lasting relief from the pain. Now about inflammatory arthritis, which is like multiple joints involvement, you will need by and large medications only and no other treatment is required. Sometimes if the pain is severe, you might need a little bit of physical therapy in terms of cold or heat therapies. Sometimes people do give what is called aqua therapy, that is water therapy. All these things are there, but by and large the mainstay is medications to keep the reaction that is happening in the body under control. So how long do you take this treatment? Arthritis by and large are a little bit severe during cold seasons and whenever the season becomes a little bit cloudy. When it is warm, sunny, the symptoms are less. So accordingly, when it's cold, you will need a little bit more medication, and when it's sunny, you will need less medication. And sometimes when it is warm and hot, there will not be any medication requirement at all because the weather is taking care of it. So if at all it's cold or if the symptoms are coming down during the warm conditions, you can stop the treatment during warm conditions, and when it gets cold, you will need treatment. There are other situations where the pain is persistent even during warm weather. That's when you will need treatment at a lower level during the summer or the warm conditions and a little bit more during the cold situations. This treatment is usually started as a 3 to 9 months course. Sometimes it can go on for 3 to 9 years, 10 years, 15 years, sometimes 20 years, but treatment is absolutely required till the body has got that reaction going on inside. You will need treatment. Don't stop the treatment in between because that can lead to deformities of the joint and can lead to incapacitation. That is, you will not be able to work normally, your hands can get deformed, that you won't be able to eat your food, you won't be able to hold things. So treatment for arthritis is mandatory, has to be taken depending on the amount of reaction that's happening in the body. So for arthritis, other than medications and physical therapy, there are certain things that you can do, that is keeping the body warm, keeping the body active, going for a regular walk, learning things like yogasana or stretching exercises or going to gym on a regular basis will keep your joints mobile. But this can't be a substitute for medications. This physical therapy, activity, walking or keeping yourself warm is not a substitute, it's an additional thing along with the medication. Don't stop your medications to do all these things. There are some people who would like to take alternate medicines like homeopathy or Ayurvedic, nothing wrong with it, but if the practitioner is good and if they are giving good medications, you can as well take it. But as an allopathic doctor, I recommend allopathic treatment. Ayurvedic doctors probably will be able to help you in those terms. I am not telling which is superior, which is not superior or which is inferior. All medical streams have got good treatment for long-term arthritic problems. You will have to take it according to your requirement and according to what the doctor says. Long-term treatment for arthritis is known. We need to give long-term medications. Some of these medications have got side effects on the body, more so on the blood and blood manufacturing or production in the body. So based on this, you will need a regular checkup. Sometimes they are also damaging the liver and also very rarely kidney. So you need to be monitoring this regularly. Generally 6 to 8 weeks, once in 6 to 8 weeks, you will have to go meet your doctor for dosage adjustments and also to get your basic blood test done to check if at all there is any problem and accordingly change the medication or change the dosage. There are some medications which can affect your eyes also. So periodically eye checkup is also required. Maybe once in 4 to 6 months you need to get your eye checked based on the medication you're taking. There are very few medicines which affect your eyes. So if you're taking those medications for arthritis, you will have to get the eye checkup regularly done. Arthritis are different types, generally categorized as seronegative and seropositive. Seropositive is when you do a blood test, you get a positive reaction which says that it is rheumatoid arthritis. So we know exactly what the condition is, we can treat it. Then there are other conditions which are seronegative, where the blood tests come negative but you have all the symptoms and all the signs of arthritis, like joint pain, swelling going on for more than 6 to 8 weeks. So these are called seronegative arthropathy. Rheumatoid arthritis is by far the commonest type of arthritis, and that can affect Usually in the families, but without family background also, you can have a rheumatoid arthritis. It comes under, again, an autoimmune disorder. One of the immune system of your body is reacting to another immune system, and those reactive material is getting deposited in the joint, and that leads to inflammation. You will need long-term treatments, minimum of 9 months. Sometimes it can go on for lifetime also, but usually after about 8 to 10 years the reaction slowly comes down and it can stop completely. Till that time the reaction is going on in the body, you will need treatment. The other arthritis are associated with some other problem, like a skin related issue called psoriasis can also have arthritis, then we call it psoriatic arthropathy. All these seronegative or seropositive arthritis all come under autoimmune reactions or autoimmune arthropathies. Then this is skin related is psoriatic arthropathy. Then there is a spine related which is called spondyloarthritis, where your spine, that is the backbone, gets affected more than the rest of the body. There will be severe back pain, sometimes stiffness, sometimes inability to move also. Such severe pains can happen along with other arthritis, other joints of the hands or the feet can also happen. Then there are arthritis which can affect your lungs. Then there are arthritis which can affect your kidneys. So there are all these things have got different tests or different modalities to detect, and accordingly treatment will be given. If it is only arthritis, then arthritis specific treatment are given. If at all it's associated with your skin problem, then skin specific treatment along with arthritis treatment will have to be taken. If it is kidney related, then kidney related treatment and other joint related treatment. So depending on the type of arthritis, you will need treatment plus an additional treatment according to a additional problem that has occurred, like respiratory problem or the lung problem or kidney problem or a liver problem. You will need a little bit of different treatment in that.